Greetings all. Thank you all so much for joining today's webinar. Today we'll be discussing how you can provide breastfeeding support to your employees. If you are an employee attending this call, we'll also be talking about ways that you can prepare for your transition back to work, or if you have already transitioned back to work, ways that you can advocate and pitch your employer providing breastfeeding support. So deeply honored to have all of you here with us today. My name is Andrea Polito, and I lead the SimpliFed organization. We're a telelactation company. But today we're going to talk more broadly about how companies can provide breastfeeding support for employees. So a quick run through of what we'll be discussing today, ways to uplift new parents that are making that transition back to work. We know this is a major moment that matters for retaining women in the workforce. So we're going to talk about how to support them in that journey. Also, we're going to talk about different strategies and tactics for providing breastfeeding and baby feeding support in general for new parents, whether that support is in-person work environments or virtual work environments. And also, we know one of the major questions employers have is, what is that return on investment for providing breastfeeding support to your employees? So we're going to cover all of these topics today. At the end, I'm deeply honored to introduce my partner in crime, Stephanie Santolo from Milk Stork, and she's going to talk to you about ways to work together as well. And then we'll leave some time for Q&A via our Q&A chat function. So as you have questions during this webinar, feel free to type in questions in the Q&A section, and then we'll cover them at the end. Also, this session is being recorded. If you have to duck out at any point in time, we will be sharing this recording after. Okay. So let's back up though, because breastfeeding support is an oh so important topic, but there's a reason that we're having this conversation today over webinar. And the fact is, and this is great news, is that more women are in the workforce than ever. And you can see the chart here from the Organization for Economic Cooperation and Development, or OECD, and that the labor force participation of women over time in general has increased. Now, there was a slight dip around the last recession in 2009, but overall, the labor force participation of women has increased over the last few decades. And in general, the women employed that are employed is growing during childbearing years. And so more and more women are staying in the workforce as well. And this is something that we should all be loud and proud about as well, is that women have held the majority of jobs in the United States, over 50%. And this is according to the Bureau of Labor Statistics. So more than ever, we need to be supporting women in the workforce because we're the majority at this point. However, despite being the majority in the workforce, we know that women are disproportionately handling issues related to childcare. So if you look at this chart, and this chart was put out by the Pew Research Center, so this isn't just anecdotal, that if you look at the average number of hours per week that are spent on different tasks and you compare moms versus dads, you can see that the green is paid work, the light teal is housework, and that yellowish is childcare. And if you compare moms to dads, moms are still handling the majority of housework and childcare issues. And so we've seen this come out, unfortunately, during the pandemic in pretty dramatic ways. But even pre-pandemic, women are now working more than ever. We're the majority of the workforce, but yet we're still disproportionately handling issues to childcare along with housework. And due to this is a major stress factor and a major burnout factor for women. And a woman in general leaving the workforce after having a baby not just creates repercussions for them personally, but this has major repercussions on employers as well. And if you look at the graph on the left, this is from the US Census Bureau, the labor force participation rate changes pretty dramatically after having one child. And then if you look at that bottom line, that's more than one child. So why is this important for employers? It's that not being able to retain women, frankly, you lose a lot of money because you lose that woman that is leaving your workforce, who you've trained, has knowledge, perhaps intellectual property, perhaps leads a team, perhaps is a key member that's building something that has a lot of value. And stats that I've seen is that employers lose up to $150,000 per employee when they are not able to retain them. Now, of course, this dramatically varies depending on the type of work they're doing. That can be a lot more than that or a lot less. But nonetheless, this has financial implications to employers. And we're going to dive more into that during this session. And more than ever after COVID-19, there's this strong financial imperative to retain employees because more and more women are leaving the workforce. And this is an issue because you've trained them, they're working, they're contributing value at your organization. However, this also has implications for your talent pipeline. And this is why we see a lack of women in executive leadership roles when you look at Fortune 50, 100, 500 companies. And if you look here on the left, during COVID-19, you can see that the percent of adults that have children, and this is broken down of women versus men, more women have left the workforce due to childcare issues specifically during COVID-19. And this is across all age ranges that you can see here on this chart. So more than ever, we need to do more to retain women. And the Society for Human Resource Management had this great quote, which really resonated with me, that working moms have hit a maternal wall, which is the extension or the motherhood equivalent of the glass ceiling that women have unfortunately faced for decades. And this picture on the left, I'm sure, is familiar to many people on this call, whether it's something that you have personally experienced yourself, or perhaps you've seen a coworker experience it. I was on a call last week with someone, and they said that they saw their coworkers' first steps, their child's first steps before they did, because the child started walking in the background. Now, on one hand, that's a funny story that they were able to see that. Apparently, the story goes is that they said, "I didn't know that John was walking," and they're like, "Well, they are walking," and then they said, "Turn around," and their child was walking. So while that's a funny story, we're all seeing firsthand, whether it's you yourself or your coworkers, how difficult it's been during this past year. But I think what this has done is actually brought the issues to light that working parents face, not just working moms, but working parents face. But we know from the data that working moms are disproportionately affected. Now, to take even another step back, even outside of the pandemic, being a working parent, especially a working parent of a new baby or a young child, has been difficult. And I'm not sure how many of you have seen the show Working Moms, but I think this perfectly encapsulates it. In a bathroom stall, pumping, on a work call, trying to make it happen, uncomfortable as heck. And so even though the pandemic has brought things to light, outside of the pandemic, this has been an issue that has been brewing for a while. And there's so much that we need to do to support working parents, not just with breastfeeding, but more broadly. But to drill down on breastfeeding, it's one of the major contributors to women leaving the workforce. And there's a number of reasons for this that have been pointed out in the literature. But one of the big ones is lack of break time. So if you are an hourly worker or a salaried worker, having to work through having times that you would have normally been feeding your baby or pumping, and not having dedicated protected break time, or feeling that pressure to continue working, or only having a 15-minute break and the bathroom line being long, or having a meeting pop up where your manager needs to speak with you urgently and not feeling comfortable to say, actually, I need to pump. Related to that, having inadequate facilities for pumping or storing milk, such as a refrigerator. Milk only lasts about 4 hours on a countertop at room temperature. And so if you don't have a facility to store, or if your ice packs thaw, then this can be difficult. Or transporting milk home if you're in public transportation, that's another thing. Or transporting your supplies to work. I worked out of a co-working space last week, not from home, and I had 3 bags to carry my pump and the associated equipment and a cooler bag, etc. And so if you don't have adequate facilities to pump, but also everything around pumping, this can lead to not supporting parents, and then potentially drive them out of the workforce and not retain them. Lack of resources in general that promote breastfeeding. And a lot of that is the next bullet, which is not supporting your employees breastfeeding. So saying, actually, I can't meet in person during that time because that's typically the time that I'm pumping. Or the grimaces, and this goes to the last line, whether it's conscious or unconscious, that you might do if you hear that one of your coworkers needs to pump. And we know that there's tremendous discrimination of women that are trying to pump or breastfeed at the workforce. And some of that is very conscious bias by things that people say or do, such as saying, actually, I can't meet during that time because I need to pump, and still scheduling the meeting. Or we also know that there's a lot of unconscious bias. And some of this unconscious bias is people actually wanting to support the working mom. So for instance, Harvard Business Review published an article last year that showed that one of the major barriers that's keeping women from growing up into leadership roles is that once they have kids, often they're not offered that travel opportunity, which can often be linked to promotions and networking. And the coworker is thinking, oh, well, I'm actually doing right by them, not offering this opportunity to them to travel because I know they have young kids at home. But actually, what research shows that by not offering, you're keeping them from getting that promotion or networking opportunity. So one of the things that this article says is that always offer, and then leave it up to the coworker to decide, give them that option, give them that choice on whether they want to go or not. And now there's great support infrastructure with services like Milk Stork that can help support traveling parents that are trying to breastfeed. So this is another anecdote of some of the conscious, but also unconscious bias, people actually trying to be helpful in supporting breastfeeding journeys of working moms. So there's a number of contributions that lead to women leaving the workforce. In particular, breastfeeding is one, but there's also barriers that breastfeeding women face that drive them out of that workforce. And what the statistics show is that half of all pregnant women say they'd consider leaving their workplace for a job that better accommodates breastfeeding mothers. So notice what I said there, pregnant women. So these are not women that have already had a baby, but women that are anticipating, thinking about what they're going to do once the baby's born. And if that supporting culture or infrastructure is not there, then they'd consider leaving their job even before their baby's born. And again, you see the image here of working moms. And I can personally say this is something I have done, been on a work call, pumping in a bathroom stall, but still, getting that caffeine in. And it doesn't need to be this way. It doesn't need to be this uncomfortable. So now that we've said all of that bad news, here's the good news. We know that support like paid parental leave, as an example, and enabling breastfeeding infrastructure, such as having a lactation room or supporting services like SimpliFed and Milk Stork, or having a lactation room with a sink, or in general, a culture of employees that accept breast pumping at work. We know that this supporting infrastructure matters and makes a tremendous difference in retaining women in the workforce. And there's data to support this. As an example, you can see the data on the left surrounding the importance of paid parental leave in supporting and retaining women in the workforce. Here's the other good news, is that studies have shown that increasing breastfeeding support for employees retains them pretty dramatically. Companies with lactation support programs have retention rates of employees after maternity leave of close to 100%, 94% compared to the national average of 57%. So almost double the retention rates that are out there. So breastfeeding support matters. This is evidence-based. This is not just us saying it matters for the sake of it, but the data proves it. Here's the other good news about supporting breastfeeding for your employees is that if the employee is able to breastfeed, if they can and want to, what research shows is that when on average you get more women in your workforce breastfeeding, the medical claim savings also come from this. About $1,400 in medical claim savings on average per every infant that is breastfed. So this is, again, contributing to your bottom line, not just with employee retention, but also saving you money if you provide benefits, healthcare benefits to that employee. Health plans like Aetna have shown that for every dollar they spend on breastfeeding support, they get $3 back on cost avoidance. And so here's a 300% return on every dollar that employers invest in breastfeeding and lactation support programs. So this is real money that goes into cost savings for employers. Not to mention that there are on average incredible health outcomes for your employees. For the babies of your employees, access to breast milk has been shown to reduce ear infections, GI diseases, etc. Now, why reducing ear infections matters not just for the baby's health and, of course, the claims tied to that are often tied to your employer, but also I can speak for someone as a child that has had ear infections in the past. That's a day off of work, perhaps 2 days or 3 days off of work that your employee needs to take them to the doctor, and perhaps they have a temperature associated with that as well and have to stay out of daycare. And so keeping babies healthy is not just a good thing for the baby, of course, but also it prevents absenteeism as well. And for the health of mom, we know that breastfeeding and meeting expectations surrounding breastfeeding can reduce postpartum depression and anxiety, along with the reduced postpartum blood loss and the risk of breast and ovarian cancer. Now, despite all these great health impacts of breastfeeding, only about 25% of babies are exclusively breastfed, which is the American Academy of Pediatrics recommendation and that recommendation is exclusive breastfeeding for up to 6 months. That's also a Herculean task for any mom, not just working moms. And there are a number of reasons for this. And one of the major reasons for this is that transition back to work. We know from research, but also just personal experience, that there are a few moments that really matter with supporting breastfeeding for your employees. Some of them happen during pregnancy, actually, is setting expectations and helping prepare them for their breastfeeding journey, making sure they order that breast pump. In the hospital, we know that getting support in the hospital from IBCLCs right there matters. Those first days home are critical for helping to support moms on their breastfeeding journey. And then undoubtedly, breastfeeding's hard. Trouble strikes, whether that's mastitis or milk bleb or not being able to latch again. There's a number of issues that can arise. And in particular, we know a huge area of opportunity or issue area that many breastfeeding moms face is during that return to work, whether you're an hourly or salaried employee. And so we wanted to take a couple minutes now that we've talked about the bottom line of why it's important and critical to support breastfeeding for your employees in terms of employee retention and healthcare costs and reducing employee absenteeism. But wanted to take some time to talk about ways that your organization can help support breastfeeding moms. On the left, I want to show an example of the return to work worksheet that we often work with new parents surrounding of what does that return to work look like. So what are the things that you can do as an employer? So first off, assemble a playbook of sorts of recommendations that are specific for your organization to help moms that are transitioning back to work make that transition. So here are some of the strategies that we recommend. First off, make a plan and encourage them to make a plan. We know that the first day matters. That first day back to work is a critical moment in time for whether they stay in the workforce, because their experience that first day can have ripple effects after. So encourage moms in your workforce to think about, what does that first day look like? What does pumping look like at work? What is the environment that it will be in? Where's the lactation room? Do you need to bring a cooler? Do you have a refrigerator or freezer available for supporting and holding that milk in case it's a long work day and the ice packs dethaw? Do you have a hand pump? Do you have an electric pump? Do you have a wireless pump? What type of pump will you have? Have you tried out your pump ahead of time? This is something that I know is really important to me, is that putting together a pump for the first time, whether it's a wireless pump, even a hand pump, or even a regular plug in the wall electric outlet pump. It's sometimes not intuitive. So making sure that mom has practiced putting together that pump before. Having them test out using that wireless pump. If you have an LV or Willow or something like that, or again, a pump that plugs into the wall, it can sometimes be difficult using it for the first time. So making sure they've tried it on for size at home and tested it out, and making sure they have all their parts, encourage them to double check and triple check. I know one of my first days back at work, I forgot one of the phalanges. And so pumping at work becomes extremely difficult, and I had to leave and go home early. Making sure they know that it's okay to block off time on their calendars for pumping. That's critical. And having that protected time and coaching them that they don't have to share that they're pumping, but just blocking it off on their calendar. Also, we know that employee sentiments and that, again, that conscious or unconscious bias really matters during this period of time. We know that other employees, perhaps employees that have experienced breast pumping earlier, many years before, can sometimes stigmatize breastfeeding at work. I know comments like, when I was your age, I didn't get a lactation room. And even though they're in their heart trying to be supportive, comments like that, those unconscious comments, can make a big difference on supporting parents back to work. So a big thing is providing training for all of your employees, and in particular management, surrounding how to support breastfeeding moms at work. And it doesn't need to be an hour-long training. It can be part of existing trainings that you have in your workforce, but it's particularly important for their supervisor to be aware. And also for the working parent to speak with their supervisor or manager before returning to work about their expectations for what their goal is for being supported during this transition. Also, we know, if possible, and this is not possible for all jobs, for the jobs that is possible, is that allowing your employees to work remotely can make a major difference in their retention. Being able to more flexibly pump, or if they have in-home childcare support, being able to continue to nurse and express milk at the breast matters. We know that it is just easier to pump at home because you have access to all of your materials here and don't have to transport it and lug it into work, which can be tiring and taxing, and just, again, drains on the parent. So being able to work remotely flexibly, perhaps starting part-time and then transitioning back full-time to work, if that's what works for the parent. We know that working remotely is a world of difference easier for parents. And by the way, they're still as productive because they're able to work in an environment that they're comfortable in and support them in that journey. One other thing that's small but matters, creating a culture where you don't need to turn on your camera. Some women, myself included, I've figured out the perfect camera angle that you can do to pump and not have no one see. Just to demonstrate that, I don't have my camera on right now, but I am pumping during this webinar to show you that you can actually, it is possible to pump and be at a meeting if necessary. Not advised, but if necessary. But creating a culture that you don't need to turn on your camera possible. And there's a variety of reasons for this, but in particular for breast pumping or breastfeeding moms, it often is more comfortable. To that point too, and speaking of employees and personnel at your work and managers and supervisors, I just can't express this enough, that it's so critical that their team members, their supervisors, support them on their breastfeeding journey. And they don't need to know every time they're going out to breast pump, but we know that the comments they make matters and can really put breastfeeding moms down. And again, that impacts their ability to retain them. And another critical aspect here is making sure that their supervisor, in particular, knows about breastfeeding accommodations available. Now, I will be the first one to say that before I had a baby myself, I have made this mistake. One of my team members asked me, Andrea, do you know where the lactation room is? And I had no idea. And I was like, oh, I think you can pump in your stall though. So I myself made this mistake. And so again, we're all people, we're all humans. But if you have a coworker or someone that reports up to you that is out on maternity leave, take the time to ask where the lactation room is so that you can support them. But also, as we talked about, make sure that they know that you know that you're there to support them. Another fun fact that I wanted to share about supporting breastfeeding moms is that in all 50 states, breastfeeding and baby feeding is allowed in public. And so this is an expectation, and it's woman's right to be able to breastfeed and breast pump and breastfeed in public. And so there is state legislators that have made rulings and policy on being able to breastfeed. So employers should support it as well. All right, now let's talk about supporting infrastructure here. So this is one example I love of an example of a lactation room that one woman experienced on her transition back to work. The good news is there is a room. The bad news is that's all. It was literally just a room with some empty boxes. It was an old storage room that they cleaned out. And as you can see, this is the opposite of comfortable and supportive. Here's another one. Oh, great, we have a closet for you. But it also happens to be next to the wiring and the data storage, which is extremely hot. And oh, we have a chair in there, but you have to wheel it around to find the closest outlet. Not the best. And then sometimes everyone is trying and trying to create a supporting infrastructure, but little things matter. Like one time when I had to breast pump at work, they had a lactation room, check, awesome. But the chair in there was insanely uncomfortable. And this was 6 weeks after having a baby, where, it's not that comfortable to sit on a plastic chair for long periods of time. So again, even with being supportive, there's a lactation room, but truly think about what that experience is like. Sitting on a hard plastic chair for 20 to 30 minutes at a time, several times a day, is not going to be good for women's health and their pelvic floor in particular. So here are some examples of lactation rooms. Now, the one on the left is what great looks like, is what perfection looks like. And I get it. All workplaces don't have that type of space and room, especially if you're a small business. But there are small things that you can do. I love this picture in the upper right. It's partitions matter, and having access to chairs that are comfortable, or maybe there's a pillow on the chair. And so what does this physical infrastructure look like? If a woman does need to be in person for whatever reason, maybe it's their choice or maybe it's required by their job, having a lactation room that's not a bathroom stall or a closet is ideal. Other things that are ideal, again, not always possible, but are ideal: comfortable chairs and a bench and desk at the appropriate height. Many women, not all, like to answer emails or try to catch up on work while they're pumping, if possible. It's not always possible though. So having a bench or desk that's at the appropriate height. I've seen lactation rooms where the bench or desk is way too low, and that creates back issues. Again, women have just given birth, so make sure they're comfortable if possible. Again, if possible, having a sink to wash pump parts, and dish soap available so the woman doesn't have to bring that in, add to the many things that they have to carry in extra because they are pumping and feeding at work. So one funny anecdote here is on one of my first days back in the office at a prior job when I was breast pumping, I was washing all my pump parts in the community kitchen there. And I was washing one of my parts, and the soap made it very slippery, and all of my pump parts went across the floor. And I had an extremely hard time finding it. And actually one of my coworkers stepped on one of my pump parts, which in a way I was grateful for because it found it. Now, so if possible, it's nice to have a sink in the lactation room, but we know logistically this is hard. But nonetheless, having access to a sink with dish soap and ideally a refrigerator. If possible, a cubby to store items. So, say they don't have their own office or cubicle space, having a cubby to store their pump. That way, they don't have to lug it around with them all day. And as you can see here on the screen, here are some examples of drying racks at workplaces. So that way they can just leave it there and then come back to it if possible in the lactation room itself. But to go back to a comment on a prior slide, having options for remote work, especially during that initial transition back to work to create that flexible environment, has massive implications on retaining them. Other ways to support breastfeeding moms at work, and a little biased with this next one, but having access to lactation services and telelactation services so that they can get that support during those moments that matter that we previously mentioned. So during pregnancy, allowing for your employees to have an appointment so that they can think about what pump to buy, how to put together the pump, what is their plan surrounding breastfeeding? Is it fully breastfeeding or combo feeding, whatever that looks like? And then surging support to them right after baby's born to continue to help them in their journey. In particular, perhaps their milk hasn't come in and they have questions about that, or questions about the latch or positions. All of these things matter dramatically. We know that lactation support dramatically increases breastfeeding rates. Also, we know that services like Milk Stork that pay for shipping and providing services for shipping milk, and Stephanie's going to talk about that later as well, have massive implications on moms that have transitioned back to work and have to travel to work. These are key moments that matter and support services that make a huge difference. Now, this is not possible for all employers and employees, but there is a ton of extra gear that needs to be purchased once you make that transition back to work to support breastfeeding. So one of the things I've already mentioned is that lugging a breast pump to and from work, maybe on public transportations or to and from your workplace, or if they walk to work, whatever that might be, is a huge pain. And so paying or giving a small stipend to cover some of the gear that comes along with having to pump at work. So paying for giving a stipend to allow them to pay for an additional pump to have that pump at work, or a wireless pump. So wanted to show some examples of on the screen in the upper left picture here. That woman is using a wireless pump. Some examples are LV and Willow. And this is hugely helpful for allowing a woman to work. I have a friend who is a NICU physician, and she used an LV pump during a code. So these are effective. Now, they aren't the most comfortable as if you didn't have it in, but nonetheless, they are incredibly helpful for allowing women to pump while at work, especially women that need to be on their feet. And so insurance often doesn't cover these wireless pumps or covers a small fraction of it. So providing a stipend to help cover things like that. Also, having to buy cooling packs or nursing covers, say if a lactation room isn't available. And if we're in worst case scenario, a car adapter so that they can plug in their pump in their car. Again, that is not the ideal scenario, but if we're in a worst case scenario situation. Wanted to share this example from an employer on how they communicate and reach moms where they're at surrounding breastfeeding. So at this particular employer, they have a ticketing system so that when an employee finds out they're pregnant, they notify their employer through a ticketing system. Other employers have email addresses such as the general HR contact us email address. So once a parent submits this ticketing system, an HR team member reaches out to them with a packet of information surrounding having a baby and what are the supporting infrastructure that the employer offers surrounding having a baby, not just breastfeeding support, but making sure to include, say, that transition back to work worksheet or some of those playbooks or recommendations that we talked about. This particular employer held a virtual monthly meeting with pregnant parents. This is a large employer, so about 15 to 40 people were showing up. That's a big range, but nonetheless, a significant number of people were showing up. So this was a moment or a point in time where they shared services and supporting infrastructure surrounding breastfeeding to their employees. After a parent has a baby and submits their FMLA paperwork, in this instance, an HR team member reaches out to them, just make sure they have all the information on the services that their company provides. This particular organization had an internal Slack channel for working parents. And then they had another channel that was dedicated to breastfeeding moms so that they can ask questions, share best practices or promising practices. And then this employer also had pamphlets. Oh, I just see a question in the chat. We'll be sharing these slides and also a recording of this information for folks to have after. So thanks so much for that question in the chat. We will be sharing these slides because we know this is a lot of information, and we'll also be sharing a recording. All right. So now that we've talked a bit about the return on investment for supporting breastfeeding at your workforce, we talked about strategies for you as an employer or you as an employee to think about during that transition back to work to support breastfeeding. Now I'd love to talk a little bit about SimpliFed and why, what we provide and why we exist. So SimpliFed is a telelactation company that helps surge access and support to new parents surrounding breastfeeding and baby feeding. And they can access the support from the comfort and safety of their own home or in the work environment. But we provide virtual breastfeeding support from a network of international board certified lactation consultants or IBCLCs. And this is so important because breastfeeding is hard. It's difficult. It does not come naturally for the vast majority of people. And so what our service does is help support breastfeeding for your employees, or if you are an employee itself. We start working with parents during pregnancy to help talk about what are their baby feeding goals, what does that look like, let them know that it takes 3 to 5 days for milk to come in, so don't stress out. What does hand expression look like during that time? We surge support to them via telehealth, often the night they return home from the hospital or the next day. We start working with them on latching and positions. When they have a question about perhaps the latch isn't going so well, or milk bleb, or signs of mastitis, which I've personally experienced last month, not the best. Or in particular, for the topic of this call, what does that transition back to work look like? And coming up with a plan and a schedule. And so SimpliFed, we provide virtual support so that it's accessible, say in the middle of the night or the middle of the day when it's convenient for parents to achieve it. My background and why we started SimpliFed is we've seen telehealth work in a variety of other clinical settings. I worked with the military to help implement and scale their telebehavioral health system of care. Also had experience at the VA where we worked on telehealth systems and saw that there is such a huge opportunity to better support moms with their breastfeeding and baby feeding journeys via telehealth. So we provide that telehealth access. And as you've all seen during this last year, telehealth and the adoption of telehealth, both by providers and patients, has grown significantly during the pandemic. And what studies show is that it's here to stay. Now, some people do prefer in person, and no doubt there are times when breastfeeding support needs to be in person as well. But the majority of services and support can be provided online, which is a whole lot more convenient and accessible for new parents in particular. And so telehealth has grown and it's here to stay. And so what does our support look like? But we're one of many providers out there, but just to show an example of what our support looks like, employees sign up for an on-demand consultation via our site. In particular, if you're a milk store client, you'll go directly through the milk store portal. You sign up for an appointment at a time convenient for you. Also, in the future, we're going to be rolling out a way to schedule the appointment via text as well. Once that appointment is scheduled, we send you a secure HIPAA compliant video link. Now it's the employee's choice on whether they want to turn the video on. If they feel comfortable, it's great, but if not, it can be without the video as well. And then the employee or mom meets with our board certified lactation consultant or IBCLC over video. And this can be done from their smartphone, tablet, or computer. So I want to do some quick wrap up comments before I introduce my partner in crime, Stephanie Santolo from Milk Stork, but wanted to arm you all with the talking points on the return on investment for supporting breastfeeding. And these same talking points work if you are the employer, perhaps an HR or a manager or supervisor, and you want to support one of your employees, or these are the same talking points you can use if you are the employee. And in summary, companies with lactation support programs like SimpliFed, like Milk Stork, have retention rates of after maternity leave of 94% compared to the national average of 57%. And increasing breastfeeding rates has a strong return on investment because it helps retain employees. And so you prevent loss of costs from having to train a new employee or the value that employee brings. Also, you save money on average on medical claims, both for the mom and the baby. You improve employee absenteeism. And in particular, the employer does see that return on investment for every dollar they spend. So we'll be sharing these slides so that you can have these talking points to arm yourself with or your employer with. But with that, I'm super excited to introduce Stephanie Santolo. She is the Director of BD and Strategic Partnerships at Milk Stork, and she's going to share a bit more about how companies can partner with Milk Stork to get breastfeeding support services like SimpliFed and Milk Stork. So over to you, Stephanie.
Thank you. Yes, and I'm so excited to be here. Good morning, everyone. Andrea, I think that was so great to just talk through breastfeeding support, which is really more critical now than ever. As mentioned, the pandemic has kind of disproportionately affected working women, working moms, and I know that Milk Stork is absolutely on a mission to support working women, and I know SimpliFed is too, and that's why we are so excited that we've partnered up. So just a little background about Milk Stork. We are the first breast milk shipping company, and we do help our clients with lactation support benefits on the Milk Stork platform, like SimpliFed and others. So we are available to work with our clients to help them support and retain their working women through lactation support benefits. So we're really excited to be here. Milk Stork, we work with about 844 different enterprise and corporate organizations to provide these types of benefits. So I am more than happy to chat with your organization. Just send me an email, stephanie@milkstork.com, to learn more about how you can offer SimpliFed lactation consulting, breast milk shipping through Milk Stork, and any other lactation support benefits you may want to provide your employees with. So thank you so much. I hope you all enjoyed the presentation. And with that, I'll turn it back over to Andrea.
Thanks so much, Stephanie. So before I switched slides, I wanted to make sure everyone saw her email address, stephanie@milkstork.com again. Last chance to take a screenshot. I'm a big fan of taking screenshots so I don't forget. I have terrible handwriting. And speaking of screenshots, this is also my email if you need anything as well or have any questions about any of the statistics I shared. But wanted to open up for any questions that folks have. You can use the Q&A Q&A function, or also you can directly chat us, the panelists, and then we'll read out your question. So if anyone has any questions, feel free to write it in the Q&A. I'll give it 30 seconds, but just truly wanted to thank you all for your time, energy, for being here. The fact that you're here, it matters, that you're letting yourself know that you matter, or that to your employees, that providing breastfeeding support matters to retaining them and supporting them. And we know that's critical for keeping them excited and retained in the workforce. So I don't see any questions in the chat or Q&A at this time, but you have my email address, you have Stephanie's email address, so please do not hesitate to reach out. And we're just so honored that you've spent your lunch hour for those that are on the East Coast, or early mornings for those that are closer to the West Coast. So with that, truly appreciate all of you, and I hope you have a wonderful rest of your day. Thanks so much for tuning in.